can look mottled and chalky, and sometimes they can be more fragile actually, but they didn't succumb to decay, dental decay. And so this expanded and they kind of went with it, to be honest with you. So there were really no long-term safety studies when they first put fluoride into the water, which was in Grand Rapids, Michigan in 1945. And this was to help as a public service um, initiative to reduce dental decay in the most cost-effective way as possible. But it's interesting to know that this is where a lot of the debates come now, is that there wasn't that due diligence, that long-term safety study before doing this. And then it slowly spread across the United States. About 75–80% of our country is fluoridated. I think it's important to know we are one of the last countries to fluoridate our water. 97% of the global modernized countries, westernized countries, are not fluoridated like we are here. So how does it work? We do know fluoride can make teeth more acid resistant. So essentially it replaces hydroxyapatite, which is what our enamel is comprised of. So hydroxyapatite crystals are replaced with something called fluorapatite. And it does make teeth more acid resistant, and therefore it reduces dental decay. But the controversy now comes with, well, do we need to be ingesting it for it to have these effects? Can't I just use it topically? And this is where some of the debates come in, especially because we do know now through some of the research and science and the Cochrane collaboratives, and there was a federal trial that we can get into, there are concerns with neurodevelopment, IQ issues, thyroid or endocrine disruption, osteosarcomas or cancers, and microbiome disruption with ingesting fluoride. And so then the controversy is, well, at what amount does this happen? And that's where a lot of the back and forth has been.
Got it. Yeah, let's dig into some of the science, both in terms of applying the fluoride topically versus ingesting it, and then contextualizing some of these potential health risks that you just mentioned. You're talking about neurotoxicity, skeletal fluorosis, lower IQ, these types of things. So what is the science, or what is the most current and recent science telling us?
Yeah, so they're teaching this in dental schools now. The curriculum is that fluoride's predominant mechanism of action is topical, meaning touching the teeth. That's how it works most efficaciously. And when you dig on the CDC site and the American Dental Association site and the World Health Organization site, they all will say this as well. But the confusing part is then you will also see them all supporting water fluoridation. So there's a lot of data and research to say fluoride works topically, not so much systemically. The Cochrane report recently came out this past fall. That's the gold standard of medical reporting and research. And it said, actually, we do not think water fluoridation works quite as well as we had once thought. Our newer science, the newer determination of looking at all the data, is that it only is reducing a couple percentage points on a population level, or about 1/4 cavity per person. So that is not statistically significant. When you look at the World Health Organization data and you look at countries that are fluoridated versus those that are not, you see the decay rates are the same. So this is something that gets left out about a lot of the conversations. We hear here in the United States, well, it's one of the top 10 greatest public health movements of the century, and our children's teeth will just become rampantly decayed if we remove it from the water, of which none of that the science is supporting. Really, if we can just have patients using topical fluoride, that would be the best bet. But there's also now alternatives that we can get into. But even more importantly, I think, is for people to realize we're not fluoride deficient. So fluoride is not an essential nutrient. No one has fluoride deficiency. There are no diseases or diagnoses from not having enough fluoride in your system. And that fluoride really it's truly a pharmaceutical method to deal with a rampant issue, but it actually all comes back to our food. And this is where the industrialized revolution comes in. So our food changed, and we started eating more processed foods, ultra processed foods, crackers, chips, granola bars, fruit snacks, sweetened beverages, things of that nature. And that's the real issue. So I think if we could work on educating patients more on the true root causes, and then potentially talking about topical benefits, that would be a safer bet where we don't have long-term safety data. We now have the National Toxicology Programs report, which came out last fall, that said these certain levels of fluoride, specifically at 1.2 milligrams per liter, they're seeing lower IQs in children on par with lead. The TASCA trial, which was the federal trial, the people versus the EPA, the judge, he made his ruling last fall, right after that NTP report came out. And he said there's an unreasonable risk to our current fluoridation practices based on the lack of any safety data. And he was looking now to the EPA. He said, EPA, you need to fix this. You need to regulate this better. We believe the EPA is probably going to appeal. So who knows what will really happen. But regardless of all of that, if you're concerned with neurotoxicity and what it's doing systemically or not, one of the main issues is that it's a medical consent issue. And this is why a lot of European countries dropped water fluoridation, is that we're mass medicating a population without going over risks and benefits. So, we should be sitting down with everyone and saying, these are the potential benefits of water fluoridation. These are their potential risks. And we're not doing that. But also there's something called the halo effect. That means, number one, it's really hard to calculate and titrate how much fluoride a human consumes. I might drink 1 liter of water a day, but you might drink 5 liters of water a day. Plus, you're cooking with it, you're making soup with it, you're boiling your pasta with it. Many do not realize also it's very prominent in pharmaceuticals. So a lot of prescription meds have fluoride in them. Ultra processed food. So any food or beverage that's made in a manufacturing plant that's fluoridated will have fluoride. They're not filtering the fluoride out at these facilities. We get it naturally in certain foods. Black tea, green tea have fluoride in them. We also are brushing with it. We're rinsing with it. Kids are swallowing it. So it's very hard to calculate how much a human is really exposed to. And so these are the conversations that are happening, that if we want to prevent disease, if people really want to be using fluoride, it should be a choice and they should be using it topically. And that the water fluoridation just poses too many concerns and there's not enough safety data. The burden of proof should be on the safety. And for some reason, fluoride, that just, it kind of came in before evidence-based medicine. And this is really where a lot of the discussion and kind of the turmoil around this is happening.
Yeah, so it's obvious that the issue itself is not so clear cut and dry. And what I'm wondering, and if you can comment on this, is you brought up the American Dental Association, CDC, WHO. They more or less all say it's safe and effective, even though now some country or you're saying most countries don't actually fluoridate their water supply. So why is this topic kind of considered out of bounds? Some say, this kind of discussion, or even what we're talking about right now, could be a danger to public health in America. Why is that?
I mean, I don't know the answer to that. I have theories. I mean, there's okay, I will say, I think people that support water fluoridation, I used to be one of them. I was trained this way. I just have a hard time looking at a patient and saying, I think it's without any risk. When I know there's other ways that I can prevent oral disease in you. So I think everyone has great intentions. I think part of the issue is you either decide to just look at teeth or you decide to kind of look at the whole human. I really think that's the separation, and everyone wants the best for the population. We're just looking at it through a different lens. I also think it's really hard for big organizations like the ADA. They've been backing water fluoridation since its inception, since the 1950s. So then to go back on that, it's very complicated. I think there could be litigation issues. There's a lot of lobbyists. The fluoride lobby group is very powerful. So these are all speculative reasons. It certainly seems to be more of a United States centric argument. I do know there's some debates going on in Australia and New Zealand right now, but like Japan hasn't been fluoridated for so long. Most of the European countries haven't either, and we're not seeing decay rates skyrocket in these areas. And the citizens now have the choice if they want to use fluoride toothpaste or not. So it's a hard question to answer. I wish it wasn't so triggering. I wish we could just take a deep breath and say, well, perhaps, can we just have a professional conversation?